So first I'm going to start off, of course, just give a little brief overview of COVID. I'm sure you've heard about COVID so many times. So many people have talked about it. And you're like, oh my God, when are we going to stop hearing about COVID? But unfortunately, COVID is still very active and people are still being impacted by COVID, infected by COVID every single day. Even as of today, there were so many people around the country that have been impacted by COVID. So I'm going to talk a little bit about COVID. I'm going to make it as simple as possible, not major details. So of course, our objectives for this evening is that you understand what is COVID-19, what are the risk factors for COVID-19, prevention for COVID-19, understanding the meaning of comorbidities, which is what the presentation tonight is primarily going to talk about, and understanding the risk factors between COVID-19 and people with comorbidities. So to start off, we all know that COVID-19 is a coronavirus that causes what we call in the medical field severe acute respiratory syndrome, or a COVID, which we know as SARS-2. We know it comes from a family of different viruses that causes acute respiratory problems. But we're gonna, as we talk today, we're gonna learn that COVID doesn't just now affect the respiratory system. We know that primarily that's what it is, right? If you remember from the beginning when this all started, a lot of people were saying, oh, this is just a common cold, it's the same virus that causes the common cold. Yeah, it is the same family of viruses that cause common cold, but it's not as simple as the common cold as we all know, right? With over 287,000 deaths, close to 290,000 deaths in the United States between February and now. That's not the common cold, right? And over 4 million people infected. So it's way beyond that. Now, before COVID, there were other diseases, severe respiratory diseases, such as the severe acute respiratory syndrome, SARS, and the Middle Eastern respiratory syndrome, they call MERS, that it's come from the same family, but COVID just happened to be a more intense, a more severe form of these viruses. And of course, more people are impacted by it. So of course, reported illness when it comes to COVID ranges from mild to severe. And what do we mean by mild to severe? Well, mild, you have people that have mild symptoms. And some of these people with the mild symptoms think that it's not as severe as, we make it out to be, right? Some people might say it's not as bad as we make it out to be. The symptoms, like we said, can be mild and they can become severe. Severe to the point where you end up in the hospital in a critical care, and I'm telling you, I'm one of those nurses that were taking care of critical care patients, and I can see how COVID affects the body, the manifestation of it. Your symptoms can be anywhere, can appear from within the first 2 days or up to 14 days. Now, I say that because a lot of people said, well, they say if you feel like you're exposed to someone that has COVID, you have to quarantine yourself, right? Stay home, try not to get in contact with people, family members, probably isolate yourself in your room, because symptoms of COVID can take up to 14 days, which we call the incubation period, before you start developing any symptoms. They say after 14 days, if you don't have any symptoms, then your exposure was not as bad and it was mild. So of course, that's why they ask you to quarantine for 14 days and you get tested to see if you were positive or negative. So what are these symptoms? We know the symptoms, coughing, fever, some people have headache, and in some cases you have people that have loss of taste or sense of smell, they can't smell anything. And if you talk to anyone that has been positive for COVID and have had the disease, the point where they were hospitalized, they will tell you, some of them, they still, even after weeks and months of the disease, they still cannot taste and have problems with the sense of smell. So chills, sore throat, shortness of breath. What does it mean, shortness of breath? You feel like you have to force the air into your lungs. You have difficulty breathing. When you're talking, you have to stop in the middle of the conversation. You have to take a deep breath. So you have difficulty breathing, and of course, muscle pain. Sounds almost like the flu, right? So kind of similar. The only thing is when you get the flu, you do your little remedies, you take your over-the-counter medication, and in 3-4 days, your body starts to feel better. But COVID is not that way, even though the symptoms are similar. So who are the people at risk? Well, everybody. In the beginning, we thought it was just, oh, these particular group of people, right? We were saying, oh, it's the older people. Yeah, it's only old people, the nursing home people, those are the ones that are getting sick. But then we found out that people in their 30s and even in their 20s and even babies were getting it, right? So and then we said, oh, probably the people that has what we call comorbidities, which Dr. Covet is going to go into more details with, right? But then we see healthy people. Like I'll use the example of my first patient, my first COVID patient in severe respiratory distress, intubated mean where they put a tube down your throat that will breathe for you because you cannot breathe, and you're on a ventilator that's delivering the oxygen to your lungs. Well, my patient was 54 years old, never been sick a day in his life, never even been to the hospital according to his family. The only time he was ever in an emergency room was for a broken arm when he was a teenager. So it doesn't necessarily mean that healthy people are not going to get it. Children are not going to get it. So yes, everyone is at risk for COVID. But tonight, since the conversation in our comorbidities are older people, and of course, people who suffer from comorbidities, which we're going to talk a little bit more, go into more details with tonight. And remember, this is an interactive conversation, so if you have any questions, please feel free to ask me. And once again, sige mwen ki pale Creole, mwen la, mwen ka pale Creole, even though it might not sound perfectly clear, but it's fluent enough pou ka kompon mwen, so please feel free to ask any questions. So who are the people at greater risk? Again, like I said, everyone is at greater risk. But, or this slide repeat, the chronic people with chronic diseases, the comorbidities such as your diabetic patients, patients with heart disease, patients with kidney disease, patient who has diseases that decreases their immune system per se. Those are the people who are at greater risk of catching COVID. And we know we are right now in what we call the flu season. Right? The flu season starts October and ends in the end of March or April, because that's usually when the flu will increase or peak during that time of the year, because in some places, you know, winter, you know, in Florida, we're lucky we don't have winter the way people up north does, but we're still at risk, especially now with COVID for the flu. So how do I protect myself, prevent my COVID from getting COVID? I'm sure you guys have heard it. Wear your mask. Yes, still very effective. Social distancing. Now the country, why are the numbers going up again? We're reopening, right? The country is reopening. People are going back to work. People are going back to school. Certain stores and restaurants and different places that were closed are reopening. And of course, this is a keeping the faith, so church is reopening. So of course, the purpose of this presentation is that so you are aware of the risk factors, and as you reopen your church, because we do need that, right? We all need that spiritual teaching, spiritual nourishment in order for us to live, especially in these times, right? Where with COVID, depression, and all sorts of things that are going on right now psychologically, the effects of the life is ever changing because of COVID. So we need that spiritual guidance and spiritual nourishment in order to keep us going. But we want to also make sure that we protect ourselves and protect our family. So the social distancing, we heard about the hand washing. We heard about the sanitizing your home, sanitizing your workplace, right? Wearing your mask. Now remember, not your chin. We don't want you to wear a chin mask or a lip mask. We want you to wear a face mask, which is going to cover your nose and cover your mouth, because we know the transmission, right? COVID, we said, is transmitted to airborne, through the droplets, right? Someone who is infected with COVID and they're not wearing a mask, they cough, they sneeze, they talk. So the droplets that are coming from their mouth or their nose when they sneeze can drop on the surface. You can touch that surface, and you know how we like to touch our nose, we like to scratch our face and probably even touch our mouth, or just by the person standing in close proximity of you and you're not wearing a mask. So now you're inhaling, and we know droplets can travel anywhere from 3 to 4 feet, and airborne can travel way beyond 6 feet, right? Because that's where you see when you go to the places, they say 6 feet apart, right? So you can inhale that, or possibly you're talking, it gets in your mouth, and then it goes in there and it lives within there, and then boom, within 2 to 14 days, you started having symptoms of COVID. So those are some of the ways we can prevent. What do I do if I experience symptoms? Well, we know testing. Well, if you have symptoms, you need to know, do I have COVID? Especially with the flu season coming that's going on. Now, since the symptoms are similar, right? How do I know if I have COVID or do I just have the flu? Well, testing is the way that we do it. We want you to be safe, right? We want you to keep your family safe. We want you to keep your friends and your coworkers safe. And most importantly, when you go back to the churches, because we want you to be safe and keep for the pastors, keep your congregation safe, and for their parishioners, and we want you to keep your brothers and sisters safe. So testing is, we know that we cannot just go, okay, I have a fever, so I'm going to take some Tylenol, I'm going to drink some tea. And for my Caribbean people that's on here, we know how we love our tea, right? And for my Haitian brothers and sisters that are participating, nous aimons tite gingembre nous, na mette citron là-dedans, l'autre tite que nous fait, the other teas that we drink, but we want to make sure that we don't have COVID, because we know the teas that we're going to drink, they only going to help us with the symptoms. They're not going to cure the disease. So quarantine, that was the word that we are, quarantine yourself, right? Stay social distancing, stay home. Like if church, those of you that have already started your churches reopening, if you know you have a symptom and you haven't been tested, please stay home. Go get tested, make sure your test is negative before you can go back to church. And I'm speaking to everybody. That's from the pastors to, you know, the ushers in the church and the congregation, the parishioners, whoever you are. So we want to make sure that we are protecting ourselves and protecting those around us. So the number one way we learn to prevent COVID, and that's to prevent the transmission, so that you, if you're infected, wearing the mask, you're protecting the people around you. When I wear my mask, I'm protecting you and I'm protecting the people around me. So wearing the mask, always remember that you're not just protecting yourself, but you're protecting the people around you. If your hand sanitizer, you can't wash your hand, there's no water around, carry a little hand sanitizer. Now they're all over the place. Everybody's selling hand sanitizers right now. So it's not like when this first started, when everybody ran to Walgreens, went to Walmart, and the shelf was empty. Now everywhere you go, there is hand sanitizers. So make sure you're carrying around with that. So now I'm gonna pass it on to Dr. Covet, who's gonna talk to you a little bit more about comorbidities, and then he'll go into details about how COVID comorbidities linked together and what we can do to protect ourselves. Dr. Covet?
I just unmuted myself. I think this is great start. And I think I'm speaking to everyone. We're probably tired of hearing all these things about COVID-19 by now, overwhelmed by the information. And it's been what, 7 months now, 8 months? How long has it been that we've been dealing with this? And so this is very complete to just get an aerial view of understanding on where we are. So I'm here to talk about chronic diseases in the face of this COVID-19 pandemic, right? What they're calling comorbidities. Now, I'm committed for this session to be very interactive, by the way. So I don't know how you're gonna pull this off, Pauline, but my question to everyone who's listening here, if you can raise your hand, there's an icon that allows you to raise your hand. How many of you all have a medical condition that you're dealing with right now? Just raise your hand. If you have a camera.
I see Miss Vicky raise her hand.
Everyone raise their hand. You don't have to name their name.
Pastor John.
How many people raised their hands, Pauline?
Well, I'm trying, they're not using the icon, but I'm going by the video of things that I can see.
Hands in front of your camera. If you're dealing
well,
with
the cameras are not on, so that's why it's hard to see. But so far, I see Miss Vicky has her hand up, Sister Vicky, and Pastor Don has his hand up. I can't see anybody else because their hands are not up.
Oh, I see hands coming up too. So, okay, so the point.
Yes, okay, Jonathan has his hand up. We have Jefferson has their hand up. Oh, there's quite a few people I can see.
Okay, got it. So what's my point? I mean, chronic disease is rampant in our community, right? And we start thinking about chronic disease as I don't want to think about it as a bad thing, because there's no power in thinking about chronic disease as a bad thing, right? God is good and God is always great. And so for me, chronic disease is just something that is somewhat part of what we deal with in life. And sometimes we can prevent them. Other times we can't prevent them. So there's a lot of different diseases that constitute as chronic conditions, right? When you think about high blood pressure, I think that is something that could be preventable. But some people might get it anyway, even though they're not obese or they're not eating terribly, and it's just something that runs in their family. Diabetes, right? Same thing. You have COPD, which is a condition of the lung. Heart disease, other medical problems. So why is it important that we talk about this? Well, our community, the Black and Latino community, that's our community right now. We have been dealing with these issues in our community for a very long time. And it's not just dealing with them. These issues are like at their highest rate in our community, for a lot of reasons. And I'm going to get into this in a minute. But there are more of these chronic conditions in our Black and Latino communities than there are in other race, right? And it'll be one thing if it was all genetics, but it's not. The reason why we, as a Black and brown community, have all these chronic conditions that are so high and worse, that are not controlled, and that people are dying from them more, is because of something they call healthcare disparities. Okay, that means that there's inequality in the delivery of healthcare for our people. There's clearly inequality in that. And the reason I'm bringing this up is because, when we think about why our community have been inflicted by this virus more than any other communities, why our people are dying or getting sick more than any other communities, it's because of these chronic conditions. It's because of how these chronic conditions have never been under control in our communities, right? So let me go back a little bit here. So we all know what chronic conditions are and chronic diseases are, okay? And I think everybody on here who raised their hand can talk about their particular chronic diseases better than anyone can, because you're dealing with it. And I hope that's the case, right? So comorbidities is basically what diseases that go along or what diseases you have in conjunction with something else that you're dealing with. And in this case, it's COVID-19 virus infection, okay? Now, I want to talk about a little bit more about health disparities before I delve into further. Does anyone understand healthcare disparities, like what causes that. And it's a fancy way of saying there's inequality in the healthcare that's delivered to us. Can anyone tell me with a raise of hand, like, what do you think is the cause of why our Black community here in South Florida, our brown communities here in South Florida, we have an unequal balance of how we are cared for? Who can tell me, give me one reason? So let's raise their hands, Pauline. Let's help me out here. Is somebody there that can tell me one reason? Oh, Bethany. Let's call on Bethany.
One of the reasons would be access to healthcare.
Wow. Well said, Bethany. Well said. You might be a healthcare professional or some expert out there. I don't know, but Bethany, that was well said. Access is actually the number one simple, most straightforward reason why we have such huge healthcare disparities in our community. So, like, what is access? What does Bethany mean by access? Well, let's think. Oh, Vicky, you raised your hand. Let's call on Vicky. What's going on, Vicky? What do you think of what I'm saying so far? Unmute yourself, Vicky. Unmute yourself. I can't hear you.
You have to unmute yourself, Vicky.
Okay, I'm mute. I'm saying maybe because of our diets, what we eat. Is that possible?
Oh, come on. It's more than possible. It's plausible, Vicky. It is right. It's what we eat. Absolutely. But Vicky, if you go back to what we eat, it's not just we choose what we eat. Sometimes that's all we have access to eat.
True.
So the bigger problem, Vicky, is not necessarily what we eat. What's the underlying issue? The issue is, how come we don't have access for the good food in our community, right?
That's right.
Healthy
That's
stuff. Right. Let's solve that issue.
That's true.
So Vicky, you caused me to jump over on how I was progressing, but I'll go ahead. You know, life is nonlinear, and so we should be nonlinear too. So I'll tell you this, Vicky. You know, one of the things to think about is that there is more to addressing healthcare disparities than what I do in my fear view, in my control as a medical physician, right? A medical provider, right? I mean, there's so much I can do. So who's going to be in charge of making sure that there's grocery stores in the right communities, there's fresh fruits in the right communities? I mean, I think that's over my pay grade. Vicky, what do you think?
Yes.
So this is why we have to consider interacting and partnering and really coming together as
Dr. Covet, you have another hand up. Brown, you have to
sure.
unmute yourself.
Okay, G Brown. What does the G stand for?
Hello, can you hear me?
Yes.
The G stands for Jalissa.
Jalissa.
Oh, hi, Jalissa.
Hi, how are you?
Nice to meet you, Jalissa. What are you hearing so far in what we're talking about?
So I was going to say lack of education, a lack of healthcare literacy, and also sometimes it's cultural, you know, like we don't necessarily know that the foods that have been passed down for ages are unhealthy.
Wow.
And hypertension.
Jalissa or Jalicia?
Jalissa,
listen, too bad you're not showing your face, Jalissa. I think that was well said. Well said. But hey, Jalissa's back. So I'll tell you this, Jalissa, lack of education doesn't really tell us the whole story, right? Mm-hmm. Because the inequality in our educational system creates the lack of education, right? So I refuse to believe that my brothers and sisters don't want an education. This doesn't happen. It's what Black people are prone to not want to learn or not want to understand what's going on around them. No, that's not true. It's the systematic racism they talk about.
Yep.
And I'm sure you probably could explain better than I can, Julissa. But that's what that is. That creates the impact of people not getting the right education or the right opportunity to educate themselves or to be aware. Forget about education, to be aware of what they can do and cannot do in order to live a long and quality life. What do you think?
I agree. I mean, it's not that Black people or people from underserved communities don't necessarily, want quality healthcare. We're just not given the opportunity systematically.
Absolutely. And, and Julissa, I got to just remind you, Dr. Holder is listening to us right now. And I just know that she's like, Dr. Coupe, you're digressing. But I'll tell you, we are not. This is all part of this whole issue of chronic diseases, right? Because it's to show you how many different things that can impact someone's health, right? If we don't have those things, if we can't get those things right, there's so much our community can do, right? And so that's, in my opinion, this is why I think like the organization like the Haitian American Coalition of South Florida came together. You have some amazing talents of individuals from all disciplines to come together to say, look, let's solve this issue about these opportunities, about people not getting tested, about why we are dying or why are we ending up in the hospital much more than any other communities, right? When this virus hit. So this is all great. And so just to redirect us back to what we're talking about chronic diseases, you know, it sounds like everybody understands the impact of health disparities and what causes healthcare disparities. But I want to just get my nomenclature right. And I want you guys to understand something. There's a difference between health disparities and healthcare disparities. I'm going to say this again. There's a difference between health disparities and healthcare disparities. Health disparities, right, is basically looking at the diseases in terms of the inequality of the diseases, right? So there's inequality in the diseases themselves, right? Some diseases are worse than others than in other populations, right? And that's because of multiple reasons, okay? Because of, as we mentioned, diet, etc. The health of the person is probably worse off of an individual who's Black versus a white counterpart. Now, healthcare disparities is the delivery of healthcare services that's also unequal. And so as a physician, my responsibility is to make sure that if I'm delivering healthcare to one person, the next person has the equal opportunity to receive the same level, the same amount, the same quality of care that I gave to the previous person. Does that make sense for everyone? Right? So the reason I want to make that distinction is because when we think about chronic diseases, we got to think about the health disparities that exist in our community, right? The healthcare disparities that exist in our community. And because of those existing healthcare disparities, and it's sad to say, they've been around for years, decades. We've been trying to address healthcare disparities for a very long time. And so as you heard one of our team person here on site here said, access is one issue, but it's also about the quality of healthcare. That's also an issue. We find that our people are not getting the quality, the highest of the best care there is not being offered to people in our community, right? And so that's an issue. There is issues around discrimination and prejudice in the provider level, right? The person who's delivering the care can have their own personal biases and prejudice, right? So all of these things can impact the overall experience of you getting healthcare in this community. This is one of the reasons why I believe that this virus has been like a super predator on our community. Like it's literally been killing us off. It's killing us off because we have already been weakened by all these healthcare disparities that causes health disparities and why our people are dying more. So I'm going to stop for a second. I just want to get some more insight from the audience on what you're hearing so far and what you want to contribute to this dialogue. Raise your hand if you have something to say. All right, Bethany, she's on a roll. Let's see what you got to say.
So you talked about some of the disparities. I also think about one of the things that is ingrained in a lot of African Americans, particularly, is when we think of the Tuskegee experiment and how that has led to our inability to trust wholeheartedly what healthcare officials are telling us.
Wow. Bethany, we really got to meet now because this is getting good. I'll tell you this. What you brought up is a major issue, which I like to coin the term of calling distrust, right? It's the distrust in our community that is also a barrier for us to access the care. But you know, that's a huge one, right? Because now it looks like it's our problem, right? We're the ones that are just like not trusting the system. That's why we're so poorly taken care of. That's why we don't access the care we should. Or better yet, it looks like it's our fault that, you know, we decide not to go to the doctors when we should because we have a distrust. It looks like it's our fault because I decided to stay home and drink that home remedy instead of going to the emergency room for a chest pain or something like that, right? So it looks like it's our fault. But when you look deep into that issue, Bethany, you start seeing generations of issues. You start seeing the link.
I'm sorry. Yeah, Pastor Don had his hand up too, so sorry.
Yes, we'll get to Pastor Don in a minute, but you'll get to see the link of how far back it goes to why this person developed a distrust. So now it is our society's responsibility. It is our responsibility to regain that trust, not to stuff something in somebody's throat, not to push somebody to do something or force somebody to comply to what they need to do. No. We need to build trust again. They need to build whoever it is that they have trust with. I, as a physician, I have joined somewhat of the healthcare team arena here in our society. So my role, first and foremost, is to build trust. It's to build trust with the person that I'm going to care for. I won't effectively do my job if the person don't trust me, right? So I think, Bethany, you hit that right on the nail. And so this distrust in our community is real, and yet it's still something that we need to address through developing trust, relatedness with the folks we care for. Pastor Dunn, talk to me. What are you hearing so far?
Well, Doc, I believe, and to all of our panelists and guests, I believe it's correlated to all of the disproportionate, systematic ills that we suffer as a people, as Black people. In almost every negative category, we are lagging behind. In every positive, for instance, case in point, you know, we have the highest, our percentages are disproportionate to our population in the criminal justice system. Our percentages are disproportionate with diseases, with infant mortality, and so on, heart disease, and the life expectancy rate for Black men versus white men, Black women versus white women is always disproportionate, and we're always lagging behind. So with the virus, it's like with anything else. I have a saying, and I'm sure you've heard it before. I didn't coin it, but when America catches a cold, Black folk catch pneumonia. You know, let me just say something. That's what makes this effort of keeping the faith so noble, because what you're trying to do in essence is bring up the level field. You're trying to level the playing field, because we were already behind before the pandemic started, you know, in teenage pregnancy. I mean, it's a litany of things I can call roll: teenage pregnancy, high school dropout, Black on Black crime. I mean, what subject you want to pick? And we lead disproportionately in all of the negative categories. So that's why I applaud the efforts of keeping the faith in everyone involved in this marvelous collaboration, because what it does, it's trying to help level the playing field for Black people in this horrific pandemic.
You know, Pastor Don, I think it's well said. Well said. One of the things I want to mention, though, just as a response to what you just said, keeping the faith. You know, I got to tell you, Pastor Don, I didn't realize how actionable faith really is. It never hit me to see how having faith was actually an actionable thing. Like it requires action to have faith. And so I've learned that for myself. And so absolutely, I think this is one of the reasons why I think I was so excited to have this platform to be able to share with you my experiences, And so when I heard, you know, the title of this whole movement here, keeping the faith, and this is exactly what we're doing. So now, in terms of what you said, when we talk about the disparities in the level in which you talk about it, it creates a reality that a lot of people feel as if they are helpless. It creates a reality as if something is being done to them. And it is absolutely partially correct, but there's another part of it that I want to push our Black people to understand, that yes, systemic racism exists. And I can tell you, if any physician or provider or scientist, the first thing we think about when we hear about problems is what's the solution, right? And so I want to know, how do we resolve this, Pastor? You know, I mean, in addition to prayer, in addition to, you know, having faith, which is, right, having a vision, wanting something different for yourself or for your community, and acting on it, making sure that your actions is consistent with that change that you want for yourself or for your community, right? So in addition to all of that, what can we do? You know, as a physician, I can tell you, one of the things that's hard for me is to accept the fact that I can't change what's happening with the violence there, with the police brutality. All of these things I'm dealing with in what we call the downstream space, right? Because I'm a downstream intervention, right? We need more upstream interventions. And all those public health people that are listening here, you know, they understand what I mean by that. You know, so as we're dealing and fixing people up, patching people up, I want support in who's in the upstream making the right policy changes, doing the right things for our community, trying to eliminate the systemic issues that you talk about, Pastor Dunn, in terms of eliminating the systemic racism, or at least curtailing it to where our people have an opportunity to survive, opportunity to have a quality life. I know we're here talking about chronic diseases, but what we're really talking about is equality. That's what we're really talking about. And so Pastor Dunn, you really got me moving right now. And I got to tell you, I really enjoyed this conversation, and I am so happy to be part of this dialogue. Now with these healthcare disparities, we talked about many things. We talked about things such as access. We talked about things such as, you know, not eating the right food, having availability to the right foods. I mean, I'll even add not having like the right parks to go for a run, or you know, exercise, or, you know, et cetera, et cetera. We can't do that because some of our communities, they're afraid to go out at night, right? So those are some issues. So I like to put those in the bucket of what we call social determinants of health, right? We do that all the time. We say these are social issues, so we don't have anything to worry about. I don't believe that. These are social issues, but I'm gonna be in the front lines because I am at the better position to advocate for my patients than anyone else who don't know them, right? So I'm gonna advocate for them, even if it's not in the exam room, Pastor Dunn, right? I'm gonna advocate for them, even if it's on, you know, if I have to go out there and protest. I've been protesting I've been in every domain so my patients can have a voice. And so I think this is awesome. And I do think that this is all related to why chronic diseases have been running rampant. They're not being controlled. And what can we do as a community? What can you do, who's listening to this, to address these chronic diseases? Because they're the ones that cause us to be so fragile when this pandemic hit. This pandemic has put us at risk. Now, first of all, we're at risk to contacting this virus, not because we're Black. I want to repeat this again. We're at risk of contacting this virus, not because we're Black. In fact, you know, I think being Black is a good thing. It's a great thing. It's an awesome thing. The reason why we're at risk of contacting this virus more than our counterparts, I don't know if you ever looked at our workforce. If you ever look at the construct of America's workforce, where are most of our Black people located? Where are most of our Black and brown people located? They're in the front lines. They're the ones that can't take the day off because they're afraid they might lose their job. They don't have the opportunity to have sick days and work remotely. So yes, they're at risk of contacting the virus because of where they work, because of where they live. Most of our people are in close quarters. It's a basically perfect formula to develop more diseases. Forget about this virus, but even more other diseases that can arise in those close quarters. That's the reason why COVID-19 is a higher risk for us to contact it. Now, it's also a higher risk for us to get sicker more than these other communities. I'm speaking in those terms, in terms for people to understand me. Forget about the medical jargons for a second. Listen, the reason why our Black people, our brown people are sicker when it comes to this virus is because of everything we just talked about. Because we are more fragile. We have more issues. We have more uncontrolled diabetes. We don't have access to the medications. Some people are cutting their medications in half just so it can last longer because they can't afford to buy more medications. We need to pay attention to that because those are the things that's causing us to be in the situation we're in. But you know, God is great because there is light at the tunnel and it's about keeping faith as we talked about. Faith requires action. Don't settle for that. Don't just accept that. We have to be part of that change. We have to. I'm gonna do my part. And I hope that everybody who's listening do their part as well. Now, I'm gonna stop again. I wanna hear from more people. What are you hearing us through this conversation? How is this conversation landing with you all? Pauline, you can jump in, let me know who you wanna select. You can tell me how this conversation is landing. I think this is a great dialogue.
Well, we have limited time because the presentation is only an hour and we only got.
Really? I thought it was all day. I thought it was all day. Oh my goodness.
A little bit late. We started a little bit late, but we only have a few minutes left. And I think, like you said, it's a great dialogue. The presentation will be again tomorrow. I think they'll be we'll be talking about comorbidities. Think everyone has gotten engaged. And the key thing that we're getting here is, yes, we are, as the African-American or the Black community, Black and brown community, are the ones that we're seeing that are getting, I guess the word you use, sicker with COVID. We're the ones that are ending up in the ICUs and are having the more severe because, I'm going to go back one slide, because of the comorbidities, the diabetes, the heart disease, the stroke, the hypertension. So these are the people that you're seeing mostly in the ICUs, and they are the ones that are dying because of the severity of the disease, because of the fact of their comorbidities. So Uncle Joe, Auntie Anne, they're dying more because Auntie Anne, you can mute yourself, please. Hard for me to see who it is.
This person.
Yeah. I'm sorry. I get distracted by the noise very easily. There we go. I just knew. So sorry about that. So the elderly patients, because Uncle Joe has diabetes, Uncle Joe had a stroke a few years ago. Uncle Joe vitamin D level is low because he's not eating healthy. He's not taking his vitamin supplements. So when Uncle Joe get COVID, Uncle Joe is the one that end up in the ventilator. He's the one that end up with the intubation. And yes, everything that Dr. Covet said and everything that Pastor Don jumped in and said as well, these are the things that lead to us. We didn't have the testing centers that was easy access for us. So what did we do? We didn't go get tested, right? So you have like the Keeping the Faith initiative. You have like the coalition who was fighting behind the scenes to make sure that we get the testing, bring the testing to the people. Bring it to the people because the people can't get to the testing, right? This was Keeping the Faith. Bring it to the churches. bring it to the community so that our people can go ahead and get tested. And as we see, the numbers are going up again. We have a dashboard in Florida that tells us what the numbers are. As of today, in the state of Florida, we had over 858,000 people that were tested positive, and over 51,000 of these people were admitted in the hospitals. So we have to do our part. And, we have people in the communities that, like Dr. Covet, Dr. Holder, and the whole team that is doing their part, like Pastor Don said, bringing the information to the people, involving the people, bring it into the community. So how do they manage this? Dr. Covet, we only have 2 minutes.
No problem. So 2 minutes. So I'll tell you, that's perfect, because, it's harder to speak in 2 minutes than it is to speak in 30 minutes, right? You can speak all day, right? But I'll say this. This is the thing. I think in one word is faith. If you truly understand what that means, then I think you heard it loud and clear. You just heard that faith means that you don't just believe in something, but you have to act. And so do your part. So yes, if you feel like you're limited, you're really not. Spread the message about wearing your mask. If you know something about how to protect yourself from this virus, do it. If you know someone who doesn't see a doctor because for whatever reason, tell them to go. There's a lot of doctors out there that are seeing patients, not just, even if they don't have insurance, there's means of doing it. Speak to your community, speak to the pastors and at the churches and so forth. There are help out there. Do your part, support each other. And again, if you are hearing this and you are a professional, see if you can play a role in advocating for others beyond yourself, because you are a leader in the community. We are all leaders. We all have to play our role. And I hope this pandemic shows that there's only one way to be, it's together. And so we have to function together. So there's not much that you need to do to have a significant role. In fact, you can make a powerful, significant contribution to this battle against this virus, but more importantly, to this battle along this healthcare disparities issue. If you see something, speak up.